So when we look at the population change in the area since 2000, we find that unlike Detroit and Michigan, the population in the Colma region as well as Kent County increased roughly by about 7%. As we look at the distribution of Colma's population by age, three alarming trends are apparent. Number one, when we look at the population 65 and over, we find that this population, which had been holding steady till about 2006, is now trending upwards. Second, we find that Colma has a larger proportion of population in the 45 to 64 age group compared to in the 20 to 34 age group. Third, we find that Colma also has more people in the 65 plus age group compared to those in the prime working ages of 35 to 44. Taken together, these trends imply that the healthcare costs are likely to increase that are age-related. It's going to lead to fewer workers that will be available to replace those that will be retiring in the future, and clearly a smaller proportion of low-risk population that is required to diversify healthcare costs. So it's important that we try to retain young workers and graduates in the region, as well as attract more skilled workers to the area.
You can see that healthcare over the last 10 years is up 74%. So we've had substantial gains there. And healthcare is now about 50% of the size of manufacturing when it comes to the wages paid to workers. So that's a substantial growth over the last 10 years. In addition, you can see that healthcare went from being about 9% of the compensation paid in West Michigan, that's Kent, Ottawa, Muskegon, Allegan, to being about 13%. So we went from being below the national average to being above the national average, because the national average right now is about 11%. So that's showing that we're seeing some movement in West Michigan to being more dependent on healthcare than what we see nationally, and we're seeing it move us toward a more diversified economy away from manufacturing.